Okay, guys, this is our final video for Reproductive Health with Miss McClellan, and it is a compilation of frequently asked questions. I don't know that frequently asked is a totally apt title, but they have been asked either by seniors who have graduated from Allegro already when I've taught this, or students on the internet. So just a fair warning here. Some of these are fairly intimate and graphic, no graphic pictures or anything this time, but that's why they get asked, because people don't have the answers to them and probably like don't really talk about them all that much. So that's just a fair warning. And if you are, you know, a little bit more squeamish about this kind of thing, maybe skip this one. I hesitate to say skip it because I think it's important stuff. And if other students your age have asked it, it might be stuff that you wonder too. Also, why did I pronounce hesitate that way? The emphasis on the last syllable, so weird. Okay, this is a big one, especially for women. We ask this: why does sex hurt, and why does it hurt? Well, sex can hurt for women, but it doesn't always. Oftentimes the first time or two will hurt because you've never done it before and your body's not used to it. That can be due to insufficient lubrication, lack of arousal, or often a psychological block against it. Conditions or infections such as vaginismus, which is basically where the vagina just won't, it basically like won't open, like the muscles contract so that the penis cannot get in. Or small tears in the genitals can cause pain for either sex. If the pain is consistent or repeated, or if it like pops up all of a sudden, see your doctor. And particularly also, like, it really shouldn't hurt for men. So if it does, get that checked out for sure. Will I bleed during sex? It is likely the first time due to stretching of the hymen, which we talked about in the first video, I believe. It can still bleed the first few times. How much just totally depends on the person, but it's not like a horror movie. It's not buckets and buckets of blood. It's, you know, it's not going to be like cleaning up a murder scene or anything. If you have random bleeding though, like if you've had sex plenty of times before and all of a sudden you're bleeding, see your doctor. You'll see a lot of that. Is oral sex normal? Yes, it is. And obviously, like, not everybody might want to do that, and that's totally fine. Your preferences are your preferences, but it is totally normal for both men and women to have or give oral sex. Is it normal to shave or wax your genitals? It's very important to realize that the word normal is subjective. Like, there's really not any norm for a lot of this stuff, but plenty of people do. Grooming is normal for both sexes. It's also normal to just leave it alone. Whatever you think about it, you should never feel pressured to do or not do something to your pubic hair to please somebody else. It should just be about your own personal preference. Is it harmful to the body to swallow semen? It is not. Semen's made of sperm and seminal plasma, which we talked about again in the reproductive video. Fluid from the Cowper's gland, and you digest it the same way you do food. And for the record, it's about 5 to 7 calories and not that protein rich, despite what jokes tell you. I feel like there are plenty of jokes about semen having a lot of protein, and that's not accurate. What happens if a guy takes the pill? Have you guys seen the deleted scenes from Bridesmaids where the little kid takes one of her birth control pills and he's like, I ate Saturday. And she's like, something bad's gonna happen to your body. I don't know what it is, but something bad's gonna happen. Well, it can happen. If a guy takes the pill once or twice, nothing's gonna happen to him. If he takes it regularly, he may grow breasts, his testicles might shrink, and his sex drive and facial hair may decrease. It's very similar to hormone therapy that you would get if you were transitioning from male to female. Masturbation, a lot of people think of that as a dirty word, but It's something that people are curious about, and it's not wrong to talk about it, especially if you guys have questions. So some questions that I've heard are, can you get diseases from it? Is it healthy? Is it unhealthy? Can you do it too much? I will say there are definitely some people who their own personal belief systems is that it's not okay to do it. And like I've said a million times, your personal beliefs are your personal beliefs, and we respect everybody's personal beliefs. Make sure that people respect your own and you respect others. But from a health standpoint, as long as your hands are clean, you can't really get diseases from it. The biggest risk is skin irritation. And you know what? I'm going to pause just in case. And I don't think this would be the case, but just to be on the safe side, if anyone is wondering what I mean by masturbation, it's when you stimulate your own genitals, when you sexually stimulate yourself. And it is healthy. It's a good stress reliever and a sleep aid because it releases good hormones and endorphins like dopamine. It's actually the safest form of sex because you cannot get a disease from yourself, nor can you get yourself pregnant. Like I said, there's sort of questions about whether you can do it too much, too often. Doing it too much is really only in regards to how much
It's 1 o'clock.
Thank you. Interferes with your life. Like if you're staying home from work to do it, that's pretty bad and not healthy, and you should talk to someone about that. Doing it too vigorously is another issue, and you kind of have to judge for yourself about that. It is good for your sex life, actually, because it helps both men and women figure out what they like, and it's 100% normal to do. Again, let me reiterate, sometimes people believe that it's not okay to do. And again, that's your own personal beliefs. It's whatever you think. But it is absolutely normal, meaning a lot of people do it. Most people do it. What is an orgasm? We've certainly talked about one. Basically, it's the peak of sexual arousal when all the muscles that were tightened during arousal relax. Men's orgasms are accompanied by the release of ejaculatory fluid, semen. About 10% of women also release ejaculatory fluid. Women often have a difficult time achieving orgasm, which is usually due to lack of clitoral stimulation. Very few women can achieve orgasm through penetration alone. So that's very important for both men and women to realize. How long do you have to wait before checking whether you're pregnant? How long do you have to wait after you have sex? Can you take a pregnancy test the next day? Nobody's stopping you, but it'll be sort of pointless. You won't be able to tell yet. The week after your period or your missed period will offer the most accurate results. You should wait at least a couple of weeks after you've had sex, because if you're pregnant, then your body needs time to develop detectable levels of HCG, which I can't actually remember what that stands for, but it's called the pregnancy hormone. And it's produced by the placenta after implantation. That's like when the egg is fertilized and it is becoming a baby. Birth questions. Oh no, how much does it hurt? And do you really poop yourself during it? Well, labor is different for everyone, and everyone describes it differently. Some women report having virtually no pain during labor, while most do report it being extremely painful, even if you were using drugs and like an epidural and stuff. Now, of course, I've never been pregnant, nor have I had a kid. I mean, obviously, you can't have a kid without being pregnant. I mean, you can. Adoption. I take it back. But I can't really speak to this. I will tell you, I have had kidney stones, and I've had nurses in the hospital tell me that they would rather give birth than have kidney stones. But that's more about kidney stones and less about labor. I think it is extremely painful. And also, it is totally normal to poop yourself during birth, and the doctors will not care. So don't worry about that. Don't worry about like being embarrassing, because they've seen it all and then some. It actually just means you're using the right muscles to push. So plenty of people, probably most people, poop themselves when they're giving birth vaginally. Does a condom feel natural? Obviously, there's no like order to these questions. They're pretty random. I like at one point I had them literally like pieces of paper and a hat. So does it feel natural? Not really. We use them in part to make it smoother than doing it without, but mostly for protection. Men and women both tend to prefer the feeling of not wearing one because it's a barrier between skin, even though it's really thin. Sometimes women have a harder time producing enough moisture if their partner is wearing a condom. It just doesn't feel as good. But there's obviously more resistance with one. Should I not have sex while I'm having my period? That is another thing that's mostly about preference, but from a health standpoint, there's no reason not to. Why do we have pubic hair? Good question. Particularly given that so many people get rid of theirs. But it is there for a health reason. It provides a cushion against friction that can cause skin abrasion and injury, and it's protection from bacteria. So a lot of people think getting rid of it is more hygienic, but that's not true. How is there any difference between inserting a tampon and a penis? It's very different. If used correctly, tampons don't feel any kind of way due to their size and the material that they're made out of. And, you know, I talked about that more in the video about taking care of yourself. And if you've got it in right, you shouldn't feel it. You'll definitely feel a penis. Why haven't we talked about gay and lesbian sex? Is it not in the curriculum? Well, the curriculum, first of all, is sort of cobbled together by me, bought from someone else and adapted to be more entertaining. But more or less we have the three types of intercourse are vaginal, oral, and anal. And the information that we've learned regarding each is relevant no matter who it occurs between. So all of the information is basically the same. And if you have further questions about that, more specific questions, you guys can always feel free to ask me. I will not think anything about you for asking that. I will, you know, if you're just curious, let me know. I also crave knowledge, so I get it. Is it possible for one breast to be bigger than the other? Yes, and it's super normal. Very few women have perfectly symmetrical breasts. In fact, very few people have perfectly symmetrical bodies. Usually like one foot is a little bit bigger too. One leg is a little bit longer. It's just, I don't know why, but bodies are weird, man. Can you have sex while you're pregnant? Will it hurt baby top of his head? Did you guys ever see that video? Look up Yahoo Answers pregnant. It's very funny, I promise. You can have sex while you're pregnant unless your doctor or midwife tells you not to. Your sex drive might change while you're pregnant, and it could either increase or decrease, but it will not hurt you. It will not hurt the baby. That cervix has got it closed up, so that baby is not feeling anything past it. How far along is too late to have an abortion? And again, I want to point out, no one is saying anything on the issue of abortion here. I know that people have very strong feelings one way or another about abortion. And again, that's totally fine. Whatever you believe is what you believe. But from a health standpoint, asking how far along is too late to have an abortion. Most states rule 20 to 24 weeks as the very upper limit. And beyond that, it's not safe. Some like doctors won't do it past that. Should I use protection during oral sex? Most people don't, but you certainly can if you're worried about extra protection. What is the Gspot? You may have heard of that. You may have not. And is it the same thing as the clitoris? This is another thing I know I talked in one of the other videos about how a lot was unknown about the female reproductive system until like fairly recently in history. And as a result of that, the Gspot is something that people are like, does it exist? Does it not? It's just like this magical spot that feels great for women. It's not the same as the clitoris. And that's also a thing that I've had to correct full-grown adults about. So if you didn't know that, no worries. While the clitoris is mostly external, which we know from the diagrams that I gave in the first video, the Gspot is located inside the vagina. It's an area that when it's stimulated, it can lead to strong sexual arousal, powerful orgasms, and potentially female ejaculation. which I mentioned in a different slide in this video. It's usually about 5 to 8 centimeters up the front vaginal wall between the vaginal opening and the urethra. Like I mentioned, there's some skepticism about whether it exists actually, because it isn't like a distinct structure of its own. It's not something that you can really like label. It's not in the same place exactly on every woman. It's just like a spot. How long does sex last? This might be the last question. I can't remember. And another one of my friends said that when she was in sex ed in high school, someone asked this question and her school nurse said 1 hour, and that's not accurate. It's obviously going to vary between individuals, but on average, vaginal sex, the actual sex part, typically lasts between 3 and 7 minutes. That does not include foreplay and does not include any other type of sex. Just literally vaginal sex. So a whole session, like from foreplay to the end, on average lasts about 28 minutes. And I think that's it. That's our last question. I hope that this was helpful. And if you guys have any more questions, need any more clarification on any of this, by all means, I can answer them, or I can try to. And I always encourage you guys seeking out information, especially about this stuff, because it's stuff that, like I've mentioned, even some full-grown adults are confused about, but it's important stuff to know. So I hope that you guys have enjoyed this. This is our last video. So, you know, hopefully you didn't feel too awkward about it. And I certainly don't, even though I'm somebody who like stutters and stuff a lot and makes little jokes. I genuinely don't feel awkward about any of this stuff. And if you guys have questions, I just want you to know that you should feel totally free to come to me or email me or anything to ask them, because there is no such thing as a stupid question where this is involved. And I will not make you feel bad or dumb or embarrassed about it or anything. So just wanted to throw that out there. I am a resource. Google is a resource. Medical websites are a resource. And if you want more resources, you can refer back to the ones I gave you in the last video. All right, this has been fun. Go forth and be safe.